Ferretti. I'm a neuroscientist and neuroimmunologist. My particular interest is Alzheimer's disease, and I am the co-founder and currently the chief scientific officer of a non-profit organization called the Women's Brain Project, which advocates for more awareness and interest in sex and gender differences in brain and mental diseases. I've been working in the field of Alzheimer's disease for the past 13 years, and I've seen the tremendous progress that we've done. At the same time, I realized that the progress and the new insights that we have haven't really reached the public, the lay public, and I feel compelled to share the knowledge, the current knowledge and understanding that we have right now with everybody. And I think that by talking about Alzheimer, by explaining what we understand now of the pathology, and by talking about what is still needed to be done, we can really push forward. We can help the patients to deal with their condition, and we can push research forward to really fit the current gaps. Alzheimer's is not part of biological aging. That's for me the most important message. People just assume as you grow old, it's just normal to start forgetting things here and there, and then the next day you are demented. And no, that's wrong. Dementia is a disease. It happens to come with age, but it's not part of biological aging. And as long as we see dementia as part of aging and not as a disease, it will never be properly addressed. So for me, that's the most important part. So early diagnosis for Alzheimer's is crucial for many reasons. I see many. On one hand, from the research point of view, it's fundamental for us to understand what happens at very early stages of the pathology. So having access to information about the patients as they are starting to have the pathology is very important. But for the patients themselves, I think it's crucial because there is no chance or very limited chance to have a treatment that will be effective later on when the disease is devastating and the patient is demented. While if we manage to catch the pathology early enough, then there is really the possibility to intervene and to test drugs, to change the lifestyle, to change your attitude towards life, to make plans in your life. It empowers the patient to know what's happening in his life very early on, in a moment in which the patient is still still has the capability to make choices, and then can make choices for the future. The Women's Brain Project was founded to create awareness on sex and gender differences in brain and mental diseases. And in the process, we realized that it was absolutely fundamental to create awareness, especially in women, about pathologies that affect predominantly women. The Women's Brain Project was founded to raise awareness on sex and gender differences in brain and mental diseases. And one of our goals is to increase the awareness of diseases that affect more women than men, to empower women to have tools to deal with these conditions. And one of these is dementia, actually. So 2 out of 3 patients affected by dementia are women. So 2 out of 3 patients with dementia are women. And women have specific risk factors for dementia. They have a very different progression of the disease. They even respond differently to some treatments. So we think it's very important to inform women about their specific risk and about what they can do to prevent Alzheimer and what will happen when they will finally, if they will finally get Alzheimer. We think that the awareness specifically directed at women can empower them to make important choices in their lives. Last year, there was a very important paper that came out, published by the Lancet Commission, where the risk of Alzheimer's disease was analyzed. And what it was found is that up to 30% of the risk of Alzheimer's is preventable, is modifiable. There are a number of risk factors that are spread throughout the lifespan. Some happen very early during the life. For instance, education protects against Alzheimer's disease. Some others happen at midlife, for instance, smoking or depression, and others happen late in life. And all these are modifiable risk factors that have been shown to have an impact in the risk of getting Alzheimer's disease later on. And all these affect men and women differently. So as Women's Brain Project, we think it's very important to inform men and women about their specific risk and what they could do to try and prevent Alzheimer's. So we have quite a lot of examples of misdiagnosis and late diagnosis of conditions in women, especially in women. This happens for a variety of reasons, but we think that there's a very important role played by unconscious bias, where very often women presented with certain symptoms are not really listened to, and very often they are just diagnosed with something like depression or anxiety and not really analyzed for the possible cause of their disease. We think it's something very important to raise awareness about this in the medical community and with the women, with the patients, to raise awareness on specific symptoms of women, which might present differently than from men. So it's important that doctors are educated on the specific presentation of every disease in men and women to be able to exactly diagnose it, and to raise awareness on the fact that there are a lot of conditions that are more common in women, and they must have a proper diagnosis. So for dementia and Alzheimer's disease, differences in symptoms have been demonstrated and reported in the literature. The most striking difference is that women outperform men normally in a lot of cognitive tests that rely on verbal memory. And the result of that is that when you administer a test for memory in men and women, there are certain tests where women have an advantage. Therefore, the same test might be very good for detecting early Alzheimer's disease in men, but might not be good enough for women. So these are the type of differences that we think we should raise awareness on to increase our capability to pick up even early disease also in women. So in my opinion, the biggest hope for Alzheimer's disease patients is in precision medicine. This new branch of medicine that allows us to exactly diagnose a condition and identify the specific treatment for it. What I think is really, really needed in this field is an exact biomarker-guided diagnosis, which is still unfortunately not happening. It exists only in research settings, but I think that's the future. So a precise molecular diagnosis of the disease, and after we know exactly the molecular level what happens, then we can tailor treatments for every patient according to the pathology that the patient has. This, of course, will require a lot of technology, a lot of medical cost for screenings and biomarkers and data analysis. Will also require a lot of more research into targeted treatments. But I think that this is an investment that has to be done right now because of the skyrocketing cost of dementia in the next 30 years. So I think this is an investment we need to do now to be able to face the tsunami that is coming towards us in 30 years. Today we have 50 million people worldwide affected by dementia. And in 30 years, we are looking at triple that, 150 million people affected by dementia. And the vast majority of these, about 70%, will have Alzheimer's disease. So this is huge. My hope for the future of Alzheimer's disease is the creation of a precision medicine approach that considers the individual and tailors the treatment for every patient. And this will also include sex and gender differences, which I think will be crucial to identify and optimize diagnostics and treatments for Alzheimer. My hope in short term, I think something that could be done short term, is to increase awareness on this condition and to increase the number of patients that get involved in research. Patients and even populations at risk. My hope is to create this big community of people that care about Alzheimer and that they want to contribute for finding a cure for the future. And I think that this is something we can do all together. So until now we have been trying to find a one-size-fits-all approach for Alzheimer's disease. And Alzheimer's disease is so various and heterogeneous that I think we have no chance or very little chances with this approach. I think we have to start to appreciate the heterogeneity and the variability that we have of the different groups of patients that we have. So the approach we've been trying to use until now in Alzheimer's disease is a one-size-fits-all approach. The assumption that one drug will work for everybody. The problem is that Alzheimer's is so heterogeneous. You have so much variability from patient to patient that this will most likely not work or not be optimal. So what I think we really need to do is to understand the variability that we have, to identify groups and subgroups in the patients. So something that I'm personally very, very excited about is that we do already have biomarkers that are available to us that allow us to see in the living patient what is the pathology and what are the alterations in their brains. So we have imaging biomarkers, we have CSF biomarkers, we're even starting to have blood-based biomarkers. So I think this is the future, and I think that as these biomarkers become available to the doctors, they will have to be more and more implemented in clinical practice so that every patient gets an exact molecular diagnosis of Alzheimer's disease. So I think for giving the patients the right chance to receive the right diagnosis and to benefit from what science has for them to offer right now, I think doctors must be in the condition of prescribing diagnostics, biomarkers-based diagnostics. Laboratories needs to be equipped with the right machinery to be able to run this test. And resources have to be allocated for this type of biomarker-based diagnosis. I know it's a cost, but in the end it's an investment.